Good day! I'm Yella Joy B. Badayas from BSN1 of Dela, and today I'm going to demonstrate cleansing bed bath. Cleansing bed bath is the washing of the patient on bed with soap and water. Objectives of this procedure are to decrease the possibility of infection by removing excess debris, secretions, and perspiration from the skin, to promote circulation, to maintain muscle tone through active passive movement during bathing, to alternate points of pressure on the body by changing patient's position during the bath, to provide comfort for the patient, to assist the patient's overall status, skin condition, level of mobility, and comfort. Next is the type of this procedure. This procedure is composed of two types: the cleaning bath for hygienic purposes and the therapeutic bath. Cleaning bath is composed of complete bed bath, which nurse washes the entire body of the dependent client in bed. Next is the self-help bed bath, which is clients confined to bed are able to bath themselves with the help from the nurse for washing the back and perhaps the feet. Then the partial bath, which only the parts of the client's body that cause discomfort, other or neglected, are washed, like face, hands, axilla, perineal area, and back. Arms, chest, abdomen, legs, and feet are omitted. Then the tub bath, which is mostly preferred to bed baths since washing and rinsing are easier in a tub. Then the final is the shower bath, which require only minimal assistance from the nurse. And the therapeutic bath for physical effects. And the next type of this procedure is the therapeutic bath for physical effects, to soothe irritated skin, to treat an area. Is this special consideration of this procedure? First is to remove client's gown. Begin removing from the unaffected side. If the client has intravenous tube, remove gown from the arm without IV first, then lower IV container or remove from pump, and slide gown on the affected arm over tubing and container. Then we hang the IV container and check flow rate to resist pump side. Never disconnect intravenous tubing to change a gown, because this causes a break in the sterile system and introduces the possibility of infection. Then, to put on gown, work first on the affected side or IV side towards the unaffected side. To perform bed bath, always start from the farther to the nearest side. Clients with history of deep vein thrombus or hypercoagulation disorders should not be washed in long, firm strokes. It also check temperature of water, particularly before bathing an elderly patient, because sensitivity to temperature may be impaired, and elderly patient who does not have incontinence may not require a full bath with soap and water every day. If dry skin is a problem, water and skin lotion or bath oil may be used. And while lying in bed during the bed bath may be contraindicated for certain patient. Position has to be modified to accommodate their needs. Equipment needed for these procedures are for a one-piece basin with water, temperature, and of temperature at patient's preference. So here is our water basin with water. One-piece soap dish with bath soap. So instead of that, we have liquid soap. 2 pieces washcloth or face towel for face and body. Here it is. 1 piece bath towel, 1 piece clean gown or pajama, 1 piece linen as needed here, 1 piece comb, 1 piece table protector or newspaper here, and a 1 pair of disposable gloves, and also we should have hygienic supplies such as alcohol, lotion, powder or deodorant. The first step for cleansing bed bath is to prepare our client in the environment. We should determine other care that the patient is receiving. Then we need to determine aspects of the client's health that could affect the bathing process, like limited range of motion (ROM) of joints, muscle pain, cast, or intravenous therapy. But right now our patient doesn't have any of that. Then we need to offer our client a bedpan or urinal, or ask whether the client wishes to use the toilet for commode to minimize interrupting the procedure for the client to avoid. Then we should prepare the bed and position our client appropriately. Now, as you can see, our client now is positioned properly. And we should place the bed in a high motion position to avoid undue muscle strain on the nurse's back. A loosened top sheet will facilitate draping and changes in the patient's position. Then the next thing we should do is to assist our client to move near us in order to facilitate access without undue breaching and straining. We should remove the client's gown under cover of the top sheet or blanket to maintain privacy. We should remove pillow if patient can tolerate. Removing a pillow makes it easier to wash our client's neck. Now, sir, ma-start na ako sa process, sir. Pwede mo lang ni siya, sir, makapta ng area. Kaan ko lang ni sir, yung blanket. Din ka mas comfortable, sir, may pillow or wala? May pillow, hindi ko na pagkaan mo pillow. Then, wash our patient's face. First, we should spread the bath towel under the patient's head to prevent soiling of bed linens, and the towel becomes readily available for drying our patient's face. Sir, palihog na ko sa sinuolo, ha? Thank you. And we should wet the washcloth or face towel and squeeze out the excess water. Squeezing removes the excess water and prevents the bed linen from getting wet. We should lay our hand on the washcloth and fold one side over our hand and fold the second side over the other hand to fold the lower part of the washcloth up and tuck in under the fold side against our palm to secure the mitt. This prevents wet and cold edges from brushing against the client and prevents splashing. Meat retains water and heat better loosely in our held washcloth. Then we should wash the client's eye using a clear water, using the edge of a different section of the face cloth. We should wipe from the inner canthus towards the outer canthus and repeat the procedure on the nearest eye. We should dry thoroughly but gently. Soap may cause burning and irritation to the eye, so we shouldn't use soap. Cleaning from the inner to outer canthus prevents secretions from entering the nasolacrimal ducts Using separate covers prevents transmitting any organisms, transmitting microorganisms from one eye to the other. So, sir, is ma-start na ko wash sa imo face. Close ang imo eyes. We should start from the inner to the outer canthus. Inner to the outer canthus. We should wash and rinse and dry the patient's forehead, cheeks, nose, and area around the lips. We should use soap with our patient's permission. Soap has drying effect and the face tends to be drier because if they expose to the air more than the other parts of our body. We should also clean our patient's ear, the neck, and then we should wash, rinse, and dry our patient's neck. Then we remove the towel from under our patient's head. And now we will start washing the arms and hands of our patient. I-remove ko lang ang towel, sir. For this procedure, we will place the bath towel lengthwise under the farther arm to protect the bed from becoming wet. Washing the far side first, eliminate contaminating and clean area once it is washed. So we should fold the towel lengthwise. We should bath the arm with soap and water using long firm stroke from distal to proximal areas. Firm stroke from distal to proximal areas increases venous blood return. Also, we should do it in a gentle friction in order to stimulate circulation and muscle and because it helps remove dirt, oil, and other organisms. Start from distal to proximal in a gentle friction. Long firm strokes are relaxing and more comfortable than short, uneven strokes. Then we should wash the patient's hand with washcloth or by soaking them in the basin. Then we should rinse and dry, paying particular attention to these spaces. Soaking softens cuticles and calluses of the hand of our patient. Now this is our basin with soap. And we're now going to soak our patient's hand. Loosens debris beneath nails, enhances the feeling of cleanliness through drying removes. We should wash between fingers, nails, and we should make sure that it is cleansed now and or after the bath. And we should change water also if needed. Nurse may wash his or her hands first to test temperature and tolerance of water moisture in between fingers. Changing water as often as necessary ensures a good rinsing and maintains the desired temperature. And also we should dry our patient's hand. And our water temperature is just perfect for our patient. Then we should wash arms farther from the nurse by elevating patient's arm and holding the patient wrist. We should use long, firm, but gentle strokes from the wrist towards the shoulder, just like what we did earlier. Also, we should always observe caution if an intravenous infusion is present and check its flow after moving the arm. Long, firm strokes stimulate circulation. Also, soaps lower surface tension and facilitates removal of debris and bacteria when friction is applied during washing. And we should rinse our patient's hands 2 or 3 times in order to remove the soap which is left on the skin that may cause itching and irritation. We should place our patient's arm in a triangular position, hands touching head, and wash the patient's axilla. We should use a short, firm stroke. And we should rinse the soap and dry thoroughly if the patient, and also if our patient uses deodorant or talcum powder, we should apply it. Now we're going to wash our patient's axilla. We should repeat in the nearer arm. Movement of arm exposes axilla and exercise joints normal range of motion. The axilla, unlike other skin areas, have neutral reaction which makes it less resistant to bacterial growth. Now, to finish this side, we should also wash the other side of our patient's arm. Sir, ang piyak naman na akong i-wash. Alkaline residue from soap discourages growth of normal skin bacteria. Excess moisture causes skin maceration or something. Deodorant controlled by the odor. Now, the next thing we should do is to wash the chest and abdomen. We should start from spreading the towel over the patient chest and abdomen crosswise. Draping prevents unnecessary exposure of other parts. We should let the farther hand of patient hold the upper side portion of the towel and the newer hand hold the lower side portion of the towel. Letting the patient hold the towel maintains warmth and privacy. Okay, sir, i-hold lang yung sa sir during a part. Kasi during a part. Then, with one hand, we should lift the near edge of the towel away from the chest. With a mitted hand, we should bath the chest using long, firm strokes. Now we take a chest kag abdomen. Nang! We should take special care to wash skin folds under the female client's breast. We should move our mitted hand down to the center of the chest and around the breast in circular motion, starting from the bottom going upward to the same of the nearest breast. We should also give special attention to bathing skin folds because it is susceptible to excoriation if breasts are pendulous. Also, moisture and sediments are collected in the skin folds, predispose skin to maceration and irritation. Now we're going to wash the back of our patient. We should assist our client to turn to prone position or side-lying position, facing away from us. And we should place the bath towel lengthwise alongside the back and buttocks, exposing back and buttocks for bathing. Okay, sir, i-turn to lang ka sa side position. Okay, sir. We should keep our client draped by sliding top sheet over shoulder and thighs. Get our towel with soap, rinse and dry from the nape of the neck to the posterior upper thigh using firm circular strokes. We should pay special attention to the gluteal folds, maintaining warmth. We should also maintain warmth and prevent unnecessary decrease in temperature. We should start from the nape of the neck to the back and to the side using circular motion. Also, friction produces heat as a result of rubbing, which in return stimulates circulation on the skin. Skin folds near the buttocks and anus may contain facial secretion that harbor microorganisms. We should provide back massage if needed with alcohol or body lotion depending upon the age of the patient with condition of the skin. Rubbing Rubbing and massage produce reflex action on the nerves and creates a sense of well-being. Alcohol softens the skin and makes it more resistant to pressure. So, sir, need mo pa ang na-massage ka kasang lotion with alcohol? Okay. So, no need na ang ating patient. Now, we're going to wash the legs and feet of our patient. We will start by wrapping the far leg with top sheet. Ensure that the pubic area is well covered. Expose the thigh, legs, and foot to prevent unnecessary exposure. Sir, handa na tayo, sir. We should face the exposed knees and spread the bath towel lengthwise under the entire leg, so just like what I did, and will rinse and dry using a long, smooth, firm stroke from the ankle to the knees and thigh to give areas. We should wash from the distal proximal areas to stimulate venomous blood flow and also produce venomous return. Now we're going to start from the ankle to the thigh. Sweat evaporates less rapidly on these covered areas. Sweat and dirt favor bacterial growth, hence need for thorough cleansing and drying. We should flex on both knees and drape while supporting client's heel. We should elevate legs from mattress slightly and slide bath towel crosswise under the leg. Bath towel prevents soiling of the pad linen. We should place the bath basin on the towel between legs and lift the farther foot with heel placed on the palm of the hand. Rinse it and slide the basin under the lining foot. The lifted foot. We should make sure foot is firmly placed on bottom of basin in support of joints and extremity during lifting, being applied from edges of basin against scalp, soaking shortened calluses or rough skin. If skin is dry, we should apply lotion to most lotion. We should not massage any reddened area on client's skin. Secretions and moisture may be present between areas. Lotion helps retain moisture and soften skins. We should repeat the procedure number. We should repeat the same procedure with a near foot and cover client with blanket. We should raise side rails for client safety and Also, we need to change water. Now we're going to wash the perineum. In doing this, we should assist our client to the supine position and determine whether the client can wash the genital or perineal area independently. If the patient is female, we should finish the bath with an external douche or perineal flushing. And if our patient is a male, we should put equipment within reach and ask him to finish the bath and wash our client's hands afterwards. Then, after all the washing procedure, we should dress our patient with a clean hospital gown or pajama. We should assist with grooming aids such as powder, lotion, or deodorant. And also, we should discard dirty linens into the hamper, and we should clean and return used equipment and leave the unit in order. Now I'm just going to clean our equipment. And after that, we should evaluate our patient's skin. If it is free of excessive perspiration, debris, secretions, and offensive odors. Also, we should evaluate for our patient's body position if our patient's body position has been changed and muscles and joints have been exercised actively and passively during the bath. Also, we should ask if our patient feels comfortable and does not complain of pain, fatigue, itching, irritation, or dryness of skin. And we should evaluate that our patient participates in bath procedure to the best of his ability. That's all. Thank you.